Lexi. I'm gonna go ahead and wash my hands. I'm your student nurse today, so I'm gonna provide privacy. So today, I checked my MAR and I made sure that we have an order for a central line dressing change today. So what I'm gonna go ahead and do is ask, could you tell me your name and date of birth? Bob Owens, 12/12/1999. Okay. So I checked your band, and that matches up with what you just said. Do you have any allergies, Bob? No allergies? Oh, yeah, you're due to morphine. Okay. So next, what I want to do is assess for understanding. So do you have any questions? Today we'll take off this dressing change, put a new one on. Any questions? No. So if this patient did not understand, I would go ahead, grab another nurse, have them hold down the arm. And then if this is a pediatric patient, I would maybe have their parent in the room to ensure that they feel safe. So now, and if this was a fragile elderly patient, then I would go ahead and be careful taking off the dressing. So what I'm going to do is I'm going to wash my hands. I'm going to ensure that I get my sterile field. So you don't want to reach over the sterile field. The sterile field should always be, I did not reach over the sterile field just now. It should always be at waist level, so that's what we're going to do today. So what I'm going to do is I'm going to wash my hands, and then I'm going to put on a mask for me, and then I'm going to wash my hands, and then going to go ahead and put my mask on my patient. So if my patient did not want a mask on, I would tell them to go ahead and look away during the procedure that I'm going to be doing today. So next what I'm going to do is I'm going to wash my hands, and then I'm going to go ahead and assess my site. And don my gloves. So I'm going to go ahead and check for any infiltration, any redness, any dislodgement, any extravasation. So, and I'm also going to check for Rita. So redness, there's none. Edema, none. Ecchymosis, none. Drainage. I'm going to go ahead, and what I'll do before I do Rita, I actually want to check the arm circumference. So I'd go 6 inches above the infiltration, the IV site, and I'll go ahead and measure that arm circumference. And then I would go ahead and I would also label the external length of the catheter, and then I would inspect the catheter from the hub to the site, and then I would go ahead and document those findings. And then I would want, if there was a ½ inch deviation, then I would I would always compare all my results to the last results, and if there was ½ inch deviation, then that would be a concern. So next, what I want to do is I want to check now, and now I do Rita. So I checked for Rita, and then now what I want to go ahead and do, this would not be sticking to the patient, is I would go ahead and start down here, and then you go up so that you don't pull the IV out. Go out in. And then I would go ahead and I would note the drainage and the amount. So none for the drainage, and the amount is none. So I'm going to go ahead, throw that away, and then what I want to go do is I want to go ahead and take off my gloves, wash my hands. Then I'm going to go ahead, grab my sterile glove. So I would never turn my back to my sterile field. So that's why I'm staying nice and sterile. And I never want to put my hands above my waist once I have my gloves on. But because the patient is down here, so I wash my hands, go ahead and only touch the inside of my first glove, and then you only touch the outside and you abduct your thumb the whole time. Abducting your thumb the whole time. And then I'm going to go ahead and never turn my back to sterile field. So now next what I want to do is I want to go ahead and grab, I would not touch the corner of that. You want to stay 2 inches within the line. And I'm going to go ahead and take out any of the drainage, start from the inside and go out for 30 seconds per agency policy. Allow that to dry, and that would, we don't want that to fall down. So I would have a second nurse put that back on. So could you put that back on, please? Thank you. And we'll verbalize the pretend that did not happen. So next what I want to do is I want to crack this, and then I want to go ahead and use friction for 30 seconds or per agency policy. And I would not touch that sleeve right there. I'm going to go ahead and discard that. And then what I want to do is I'm going to take my skin prep and then make a circle around, a big square around the oval window, or a window. And then I would go ahead and next what I want to do is, could you please hand me the dressing and then open it up for me? There should be another one, the bottom of the pile. This would normally, and then open it up. So this is going to be at the bottom of my catheter tray here, but for today's sake, so now, don't touch it, and then I'll remain nice and sterile. So if you could open it up for me. Okay, so we have a sterile dressing at the end, at the bottom of this box. So now what I'm going to go ahead and do is I'm going to discard that, and then I'm going to go ahead and I want to put this smack dab over the IV insertion site. And then what I want to go ahead and do discard that. And then what I want to do is I want to tape with my initials, the time, and the date. Tape. So we can stabilize our device here. Then what I want to go ahead and do is verbalize that if there was a lot of times during this dressing change, there would be a cap, so a CHG cap, and so we might be using that, but today we're not. And then for the cap, a lot of times you'll change the dressing change and then have the cap change as well. And then what I want to go ahead and do is I'm going to take off, and then I'd want to ensure that I would measure, take off my gloves, wash my hands. During my measurements, I want to make sure to inspect the cap, the hub to the site, and then I want to ensure to go ahead and I'm going to wash my hands, and then I'll take off my mask, dispose of that, and then wash my hands, and then take off my patient's mask. There you go. And then wash my hands again after I dispose of that. And then I would want to go ahead and I would want to ensure that my patient's safe. So I'd want to make sure they have the call light, that they're in a low lock position. I'd want to dispose of all my supplies. I'd want to gather my supplies in the first place. And then I would want to document my findings. So what I would document today would be all my different assessments. So for Rita, any infiltration, any dislodgement, any extravasation. I would document all my arm circumference, the external length of the catheter, and then compare that to the baseline. And then I'll go ahead and document where the IV site is, and then I'll document the date and my initials and the time, and then I would ensure to document how the patient tolerated the procedure, and then I would want to go ahead and wash my hands, and then dispose of my supplies, and then want to make sure wash my hands. I'm done with this skill.